The following educational video was created in collaboration with the Faculty of Biomedical Engineering and the General University Hospital. Care for short peripheral venous catheter. The insertion site is visually assessed using scoring systems at least every 12 hours and always during medication administration. The condition of the insertion is documented in the nursing records. The catheter is flushed with a minimum of a 10 milliliter syringe using the start-stop method. During flushing, approximately 2 milliliters of saline solution are applied and the flush is stopped for 1 to 3 seconds. This changes the laminar flow inside the catheter to turbulent flow, helping to remove any remaining medications, including blood. Dressing and covering options. A catheter covered with an opaque dressing should be redressed within 24 hours of insertion. Removal of the original dressing is performed centripetally, i.e., in the direction of the invasive entry, from the cone to the catheter tip. The covering can be removed using various methods, starting with the stretch method. First, loosen the outer dressing, then gradually stretch and release it from the skin. This will allow the dressing to come off easily. Secondly, gentle removal using adhesive remover. Gradually release the dressing while holding the skin to avoid damage. The third approach, tape method. Remove the dressing by pulling vertically. The outer dressing is loosened and the freed portion is pulled upwards with one hand while holding the skin with the other hand. After removing the dressing, disinfect the surrounding skin. For mechanical cleaning, use sterile gauze pads. Before applying a new dressing, it is advisable to use a protective film, except at the puncture site, as a prevention against damage to the skin due to medical adhesive. Dressing options. Opaque dressings are primarily intended for catheters inserted for outpatient purposes or those inserted in pre-hospital emergency care. Due to the inability to visually monitor the puncture site, redressing should occur within 24 hours of insertion. For catheters inserted under non-standard conditions, removal should occur within 24 hours. Transparent dressings. Semi-transparent dressings, and dressings with chlorhexidine that continuously disinfect the puncture site are also available. The frequency of dressing changes should follow the manufacturer's recommendations and the condition of the insertion site. The dressing should be labeled according to the workplace's customary practices. Flush the catheter using the start-stop method, check the site, and close the catheter. The connector tube can be closed using several methods. Combi stopper, a single-use stopper that is discarded after use. Disinfectant plug for lure type ends, safely disinfects the entry within 1 minute and is also single-use. Needleless connector, preferably chosen with neutral pressure. The uncovered end should be wiped with disinfectant wipes before each use. Spray disinfection is not recommended. In an ideal case, a disinfectant cap with a sponge should be used to close the catheter. The catheter can be closed directly with a flushed, needleless entry and disinfectant cap. Secondary fixation of the catheter. The secondary fixation of the catheter must be done very carefully, as any movement can irritate the vein wall, leading to inflammation. For patients with fragile skin, a highly elastic mesh dressing can be used. Removal of the short-term venous catheter. First, gently remove the dressing using the previously described methods. Then, apply a sterile tampon or gauze to the puncture site and withdraw the catheter. Palpate the insertion site. After bleeding stops, cover the site with a sterile dressing. As an alternative, an absorbent pressure dressing can be used for hemostasis. Decontaminate the equipment, perform hand hygiene, and document the procedure.